And today we're talking about something that often gets overlooked, but can make a tremendous difference in the quality of life for people living with dementia and their families. It's called palliative care. Now, Dr. Parker, I hear that that's a word that might scare a few people.
It scares people because they don't really understand what it means.
Yes, but I'm glad we have somebody today who's going to tell us what it all means.
Exactly. So today, our guest speaker is Dr. Kimberly Kursine. She is a professor of medicine. She's triple boarded in internal medicine, palliative care medicine, and geriatric medicine. And she is a nationally recognized leader, educator, and advocate for palliative and supportive care. That means anybody who's caring for somebody with a terminal illness needs to probably consider palliative care. I'm not going to define it for you. I'm going to let her define it for you. But in the world of caregiving, sometimes we need to appreciate that diagnoses of our loved ones have no definitive medical cure or treatment, which means that we end up having to basically just live with the disorder, whatever that may be. That disorder may be terminal, which means that because it has no cure, no definitive treatment, we're going to live with it until the end of our days. Palliative care is a way to help us understand how we can live comfortably and with dignity and have a good quality of life near the end. So at this time, I'd like to present Dr. Kimberly Kursine, our Winship Professor of Palliative Care. Dr. Kursine?
Hi. Hello, everyone. Thank you so much for I'm going to share my slides. So I'm so glad to be here today, and this really brings me back to my roots. I started out as a hospitalist and then trained as a geriatrician before being a palliative care provider. So primarily, when I started in palliative care, I started with taking care of older adults and people who had serious chronic illnesses. So I have no relevant financial disclosures. And so let's start. I always think it's always good to start with a common definition. So what is palliative care? Well, palliative care is the medical subspecialty that focuses on people who are living with serious illness. It focuses on providing relief from the symptoms and the stress of that illness, no matter the diagnosis, with the primary goal to improve the quality of life for the patient and family. It's provided by a team, an interdisciplinary team, which may include doctors, nurses, other specialists, spiritual health clinicians, social workers, who work together with your other doctors to provide an extra layer of support. And it can be appropriate any age and stage in a serious illness. And most importantly, it can be provided along with the curative treatment. So if you put palliative care in the Google, it's also often attached with hospice. But when you notice this definition includes support for those living with serious illness. And I'd like for you to continue to focus on that. So what actually are we? I gave that really long definition. So we're the service that specializes in the 3 H's. First, helping people to achieve their goals and to meet their needs. Hoping, we help explore and reframe hope as an illness evolves. And holistic care, we care for the whole person, emotionally, physically, spiritually, valuing human complexity. And what's our care model? So how this might be different. So I often explain when you go into your specialist, if you see your oncologist, if you see your geriatrician or your cardiologist, they are providing you excellent care, often whole person care, but it's very much focused on the illness at hand. That's sort of like the center. When you come to see us, then that changes where the illnesses that you have sit on the periphery, but you are in the center. So whatever you are being distressed by is what we are there to help with. So we mitigate the suffering, the distressing symptoms, whether they're physical, spiritual, or emotional, are treated as the primary entity. The therapies are offered if they're medically appropriate, if they control the symptoms. We view people as complex beings and what I call in 3D, realizing that whatever is affecting you emotionally, socially, and spiritually will also have an effect on how you feel physically and how your illness progresses. And we want those treatments to be congruent with the goals and values that our patients and families set for us, with the primary goal of living as fully and as comfortably as possible. So what's our scope? Like, where do we come in? So I always like this visual. So on the onset of a serious illness, and you get a lot of information. For some patients, just the getting that serious illness can be really, overwhelming. So they may refer you to a palliative care provider, not because you have pain or a physical symptom, but because your doctor's anticipating that you're going to need that extra layer of support. So that first visit may be a getting to know you visit, learning what the services are for. What I call us, I like to say, we are the tools in your toolbox. And this way, that, boy, if I'm not sleeping or eating well, if I'm feeling sad or depressed, if I'm questioning why me, if my family is struggling or my grandchildren are struggling, I know that I can reach into my toolbox of palliative care and get one of my palliative care team members to assist me. As the symptoms of a serious illness progresses, which they all do over time, then you might find that your palliative care provider is more present, where we may be driving more of the care, because what's the illness, not that it moves to the background, but as the illness progresses and we're not able to reverse the illness, but the symptoms and figuring out how you're going to live with this illness fully falls in the realm of what we do, though you still continue to see your specialist. When an illness gets to the place where we're concerned that it's towards the end of life, that's where palliative care comes in and is delivered through the hospice benefit, which we will talk about. And then beyond and after death, palliative care is there for your family. So the question is, where can you receive these services? Well, wherever we go, wherever you are. So when you are with your specialist or you're with your primary care doctor and they are treating you whole person, they provide you with information, they provide you with support, they provide you with symptom management. What you are experiencing in that moment is primary palliative care. That is symptom management and relief from suffering being provided by your own internal specialist teams. And so those of you know, and if you experience any of our brain health center providers, you can see how they're very skilled in providing these services. However, if those symptoms start to outpace what your primary team is able to provide, they may reach out to someone like me. I run our outpatient part of our palliative care center under Tammy Quest. And the outpatient supportive palliative care service is just like a clinic. Sometimes you see them embedded in oncology teams, or embedded in cardiology teams, embedded in some places in geriatric teams, and they can even be freestanding. In those clinics, we are delivering palliative care through our appointments. For some, it is very difficult to get to palliative care appointments, or it's just, you can just barely make it to your specialist appointment. Or if you happen to live in a rural area where driving back and forth or the bandwidth for telehealth is not great, you might receive home-based supportive and palliative care services. And that's where they bring people like me, either a physician or a nurse practitioner, into the home to help provide palliative care. And then, of course, many people interact with us when they go into the hospital in an acute situation where they're having acute symptoms or decisions that need to be made or families that need support might come into contact with us there. So what is hospice? So how is that different? Well, I explained that what hospice actually is, it's an insurance benefit. And what that benefit is designed to do in people who are in the last weeks or months of life, the goal is for that service to provide enough support for them and the family to live as comfortably as possible, again, physically, emotionally, and spiritually. Hospice care supports the patient and their loved ones, and it can be delivered at home. And in our country, hospice is primarily delivered within the home. There are inpatient hospice facilities, which I usually call them hospice hospitals, when people are having symptoms that cannot be controlled in the home. Inpatient hospice is there to allow a doctor, nurse practitioner, intense medical treatment to try to get those symptoms under control to help the person be able to return back to home if that is possible. Hospice is covered by insurances like Medicare, Medicaid, and most private insurances. So Advantage plans usually have hospice benefits. Many of the private insurances or the Advantage plans do follow along the same as Medicare, but sometimes they do have extra benefits. So I always tell people, if you're looking into hospice care, and you have a private insurance, you just don't have regular Medicare A and B, go ahead and call them and just ask them, what does your hospice benefit look like and what does it provide? Hospice also makes sure that the care and the comfort is needed at the end of life with 24 hours a day, 7-day-a-week support. So what I mean by that is, again, hospice is a supportive service. So if you're with a loved one who is enrolled in hospice, the hospice makes themselves available to you by phone to be able to guide you through difficult symptoms. Nurses can come out 24 hours a day in the midst of a crisis to be able to help walk you through that. You also get other services which are really important. In addition to having the expertise of a hospice nurse, you may, if this would be helpful, receive CNA services or nursing assistant services, which help provide personal care. And during that time, they can provide maybe a few hours of respite for a caregiver during the day and help do some of the activities and things that are harder to do. They provide all of the medical equipment that you're going to need, and they provide all medications that are associated with the diagnosis that you're on hospice for or that your loved one is on hospice for. And they help manage those medications in addition to providing a guide as to what this journey looks like and support for your family. So again, sometimes it can be difficult to know what the difference is. So I say palliative care is like an umbrella, and palliative care is a philosophy of care. It can be delivered at any stage during the illness. Hospice care is delivered, is the way we deliver our palliative care when a person is at the end of life, where we are worried that their life expectancy is less than 6 months. In palliative care, it can be delivered alongside other therapies. Usually in hospice care, when people are enrolling in hospice, it's usually because the treatments that they were getting before or the interventions that they were getting before were no longer working in providing quality of life. So often those are just discontinued. There are some movement to try to have what we call concurrent care, where people are receiving the benefits of hospice care along with disease-directed therapies. That's not widely spread yet, and some other private insurances may allow that. That's why I always ask people to go ahead and call and make sure. But usually when doctors and nurses are not offering hospice, if what we are doing is working, if that is working well, then we wouldn't offer that. But when you're starting to offer that, that's letting us know and a signal that, hey, maybe the things that they're doing aren't working as well. And anything that your specialist wants to do for you, they want to do things for you that are going to give you better quality of life or give you longer life. But the holy grail is that it does both, give you better quality and longer. If what they're offering or what they have to provide for you can no longer provide you with quality of life and no longer can provide you longer life, then those are things that they discourage or say they don't offer, not because they don't want to help, but because they realize that those things are no longer helping. And sometimes those things actually start to take things away, such as quality of life and length of life if they're too toxic or too difficult. So sometimes hospice is a way of giving you better quality of life and better time. Both are paid for by insurance, and in hospice is where you get that wraparound care, the nurse's aid, the medication, and the equipment. When you're in palliative care, you get the medical care and the medical expertise, but the rest, the medications and the equipment, all work the way they have always worked, through your doctors, through ordering them, and through your insurance companies. They both come with interprofessional teams, so I won't read these to you, but the teams can be very, very, very similar. But as you can see, hospice has a more robust team because when people are nearing the end of life, the support that they need and the aggressive support needs to be more shored up and more wraparound. So that's why you see way more benefits provided in hospice care. So how can palliative care and hospice benefit caregivers? Well, I don't know if any of you have seen this is what we call a disease trajectory. So you can see that when you have cancer, you're kind of okay. You're not great, but you get diagnosed and you're kind of okay and you're moving along. But when the decline happens fairly quickly, usually over a few months, sometimes years, but it's a much compressed timeline. Other organ failure and illnesses like dementia, Alzheimer's dementia, Lewy body dementia, frontotemporal lobe dementia, they don't have that timeline. The timeline is stretched out much longer, in 2 to 5 to 6 to 8 years. So for people who are having issues with heart failure or lung failure, they can be symptomatic, be fine for a while, steady, slow decline, and then have these episodes of acute illness. And over time, those episodes can become longer and longer and longer until something sudden happens, but you see the decline is a slope. So thinking about somebody having to have symptom management over that period of time. For dementia and frailty, the timeline can be stretched even longer, where there's this slow decline and you can see it over time. Usually what happens is the caregiver's watching it and it's sometimes so imperceptible. It's like your kids growing up, they grew, but you didn't really see them grow. Somehow your mind is able to block that part out. But you see like your baby and next thing they're an adult. That can be what it's like for caregivers, that slow, imperceptible decline. And sometimes feeling like, and if something happens, there can be these shifts. But again, a slow decline. So that means that caregivers are having to take care of their loved ones in a fairly debilitated state, sometimes up to for 6 to 8 years. And so caregiver stressors and serious illness can be emotional. There's physical strains, financial pressure, role overload. It can be isolating. And there's a lot of uncertainty and fear about the prognosis because when you go to the doctors, they're not able to give you a timeline. They're not able to tell you, hey, you will be dealing with this for this amount of time, or 2 to 3 years. Because the truth is, we really don't know until it gets closer to the end. We have a general idea, but we're not able to give you certainty, and that can be really, really difficult. So in addition to the stressors of caregiving, when you have support, can be wonderful. There's a lot of rewards that you can get out of caregiving, but if you have more support, though, it's much easier to access those rewards of time spent with your loved one, or the accomplishment, or the good feelings and the times and the memories that you make. So how hospice and palliative care supports caregivers is they provide education and guidance. They help you understand what that illness is and what the actual trajectory is, so you know what you're in for. They can help explain some of the treatment options that you may be offered and tend to those needs. Emotional support, so counseling, respite, space to express that grief and stress of care that can come along with caring for a loved one. Practical assistance, trying to coordinate resources. So there are lots of resources to help you. And when you go to get resources, oftentimes people get a list and multiple pages or a couple of websites. And that can be really overwhelming. So if you're taking care of your loved one and all of your time is spent doing that, then when is the time to go through the list or go to different websites or call? So we try to sift through some of that for you and connect you with services that are going to be helpful. And also the availability, offering that continued support and also support in crisis management. And with the education, we can help equip caregivers with skills and confidence to care for their loved ones. The benefits of palliative care, specifically in Alzheimer's and other dementia, again, really focusing on improving quality of life, dignity, and helping foster meaningful engagement with the help of our interdisciplinary team, our social workers and spiritual health clinicians. In addition, support difficult decision making, helping you with goals of care and advanced care planning. And most people think of advanced care planning as advanced directives and living well at the end of life. Well, what advanced care planning really needs to do is help you with the middle. Most people take care of the end very well, but what we don't plan for is, if I have an illness, what happens when I can no longer live alone? What are the services that are going to be available for me? How much are they going to cost? How am I going to afford it? Who will be my caregiver? How will that structure work, and who can I rely on? All of those things in the middle are important because they cause the most amount of stress. Also, it can help reduce hospitalizations by being proactive about symptoms and preventing crises or anticipating crises. And again, making sure that your caregivers are supported, so they know that they're in this for the long haul, and can help with continuity of care. Because as we all know, that as we move through healthcare systems and doctors change, teams change, I say we are the people that don't have to change. The benefits that you can expect to receive in hospice care specifically is, again, same as palliative care, comfort, holistic support, but that caregiver relief and the ability for the hospice benefit to provide times within that benefit of respite care, where you can actually have your loved one at a safe place while you spend maybe 3 to 5 days just to kind of recoup. And as I said, having the aide come over to provide some daily respite care for a few hours. And again, the care comes actually into the home, which is very helpful. They can guide you through the dying process to understand what those changes are, what's normal, what's not, and then also bereavement support. So just some key takeaways. Every illness has their own path, and some people decline quickly, Some have ups and downs, and others change slowly over the years, but you need to be supported through both. You do not have to do it alone. Palliative care and hospice are teams that help patients and families manage the symptoms, stress, and also help you navigate those really tough decisions. Support is available for you early. Palliative care can be at any stage of the serious illness. It's about comfort, guidance, and quality of life. It is really there as you need it. Hospice provides an extra support near the end of life so you can be more comfortable and families can have help, especially in access to expertise 24/7, as well as relief from the burdens of being able to find medications, equipment, and all the things you need to take care of your loved one. And asking for help is strength. Getting palliative care and being palliative care or hospice care involved means support, not less care. It's about living as fully as possible. So again, thank you so much for allowing me to spend time with you today. I'd like to thank the Emory Palliative Care Center, Goizueta Outreach Team, the Academy of Hospice and Palliative Medicine, and the Georgia Hospice and Palliative Care Association.
Thank you, Dr. Cursine. I am sitting up here. I'm trying to look at my computer and look at the monitor at the same time. I think that it's really important for a lot of our family members to really understand a little bit more simplistically how they can just ask for it. And the best way to make sure that they get a true definitive palliative of evaluation or assessment. And I do think, and thank you for explaining the difference between hospice and palliative care. A lot of people make them the same thing. Can you kind of help our families with that?
Right. So palliative care, I would like to explain, it's a lot of care, it's the umbrella. And so it's a type of care that really focuses on your symptoms, what you're suffering from. So you have your illness. So all the things the illness is doing to you is what palliative care is there to focus on. So when you're just starting your illness, palliative care might be delivered to you through a clinic, through somebody like me. You come to see me. I help sort of sort the problems and help deal with the things that maybe your specialists aren't dealing with at the time because they're focused on your illness, as they should be. As time progresses, if you're not able to leave your home, you may be provided palliative care through the home. So you're still seeing your specialist, but maybe it's better for you to have that care coming out to you. And where hospice comes in is where palliative care, that's the vehicle by which we deliver palliative care when somebody's at the end of life. We deliver the palliative care through that hospice benefit. And it's the hospice benefit that provides that wraparound care that you need as somebody's declining, which often requires medical equipment, special medications, people coming out to the home, more support within the home. So all hospice is palliative care, but not all of palliative care is hospice. So it's the umbrella. So hospice is just a part or one of the vehicles we use to deliver palliative care, like we use the vehicle of our clinic to deliver palliative care.
Okay, so, and this comes from Mrs. Floyd. Thank you, Mrs. Floyd. You're a regular attendee. But one of the things, it says, how can we obtain palliative care if you're not an Emory Clinic patient? You don't have to be an Emory Clinic patient, a Piedmont patient, a WellStar patient, or a VA patient. If you are seeing a healthcare provider, they can write or make a referral for, I'll say, home health care. Any home health care agency, a lot of the different home health care agencies have a palliative care / hospice unit that they can refer you to. And that's part of that home care referral. So the doctor that you are seeing is the person who generally makes the referral.
Yeah.
Okay.
And just to add to that, there are companies that focus specifically on palliative care who do deliver home-based palliative care, and Atlanta does have some of those, and they accept insurance. They're virtual, especially for rural environments. There are doctors would have multiple licenses that deliver it by telehealth. And fortunately, here in Atlanta, many of the hospice companies actually have palliative care arms. So a good portion of them do, and they do the whole shebang, what I call all of the symptom management, which is very similar to what we have. So if you're not an Emory patient and your healthcare system does not have its own outpatient palliative care, um, uh, let them know that they are able to access home-based palliative care through one of the companies that exist here in Georgia. If you are not sure about that, there is a website called More Access to Palliative Care in Georgia. It's www.moreaccesstopalliativecare. You put in your zip code and it will let you know where home-based palliative care or outpatient clinics located throughout Georgia. It also shows you all the hospitals. So I don't know if somebody would be able to look that up to be able to show that on the screen for us, the More Access to Palliative Care website. But that can really help when you're living. Yeah, it took this was Winship Cancer Center host helped to create this wonderful resource.
Okay, we have somebody working on that right now. And so one of the things that we have to accept, and I'm not sure that I really heard it, people want to make sure that they can keep access to their provider. Can you talk to your regular primary care provider in addition to having palliative or hospice care? And
yeah,
I think that, I was going to go into something else, but can you talk about that? Because people think that they have to give up their doctors.
Yeah, as we talked about in the definition, that we serve as an extra layer of support and we do not replace any of your doctors. As time goes on in your illness, you may find that we play a more important role because as the symptoms of your illness become more front and center and the ability to treat that illness becomes less so, then you may see your palliative care provider kind of driving your care. But usually, like if you have cancer or heart failure or lung disease or dementia, you still need access to those specialists to be able to help maintain that illness, while your palliative care team is supporting both you and your doctor to help make those treatment plans work the best they can.
Thank you. And just for the benefit, I've recently completed this journey with my own mother. And when you want to know exactly what does palliative care do, what do they do for you? As an example, they make giving care at home a lot easier. So they'll bring things like durable medical equipment, maybe a hospital bed that has an adjustable head or foot. They will bring things like bath benches, things like things to help you get around the home, or Hoyer lifts to help you lift people up and down. From a personnel perspective, they will bring or send certified nursing assistants to help with bathing and help you organize things around the person's space so that things are easier for them and for you, and bring you other supplies, things like bed liners, diapers, special things like that. If you have a wound care supplies like bandages, and they will even probably send a nurse, but they'll also send other providers, not just a nurse, not just a CNA, maybe a chaplain. I'm going to call her a counselor who can kind of talk and kind of go through programs with plans or questions you might have. Let's see. There are some people who want to know a little bit more about whether or not they can contact you for questions, some follow-up questions. And Ms. Plotnick wants to know how to get in touch with you. And I'm like, okay, if you look, I think Crystal and or Emily have put the Palliative Care Access Georgia website in the chat. Let me see. Who do you recommend for palliative care in the home? Does it matter?
Which companies? Yeah. Oh, yes. So all things matter. So I say everything is perfect till people get involved. So when you look at different palliative care companies, especially the ones that are connected to hospice companies, they do have ratings. And so you can look through the ratings. I find that we're very fortunate here in Atlanta that we have a very, very, very good access. And very rarely does something not really go well. Like most of the companies that we work with here, particularly at Emory, do an excellent job. I think the most important thing is when you are choosing a palliative care company or a hospice is before you sign up for a service, you want to talk to them because they all provide things that are similar, but their philosophy and the way in which they do it may be different enough that you want to make sure that it matches your goals. If faith is very important to you, then maybe a faith-based a hospice or palliative care team may be important. If you have a palliative care team and your loved one is in a facility, well, a palliative care company or a hospice company that it has experience within facilities, that's going to work better. So really think about, number one, what is important to you, what your goals are, and what are the types of people and the philosophies that you have. And usually when you do the interviews, you know and you get a sense. But yes, ratings are definitely made available.
Let me just add this one. You mentioned facilities. So a lot of nursing and rehab facilities do have I'll call it inpatient, hospice care services. So the person no longer lives at home, but they may be living at a rehabilitation facility. And a lot of facilities do offer hospice and palliative care.
Yeah, they offer it through companies very similarly. So if you are living in a nursing home or you're living in a memory care unit, that is considered your home. So it works the same way, and that they come to you very similar as if you were living in a private house. Usually, facilities, nursing homes, and memory centers usually don't have their own internal unless they are connected. Some are able to buy a company, but usually it is an outside agency coming in.
Mm-hmm. Okay. Well, thank you so much for your time and your expertise, Dr. Kursine. For our listeners and our viewers, if you look in our chat, we do have access to the different links that Dr. Kursine mentioned. One of them is to the Winship Cancer Center and Dr. Kursine's information, but also how to access palliative care throughout the state of Georgia. And for our listeners who are not in the state of Georgia, I am certain that there's a similar entity in your state. So thank you, Dr. Kursine. Thank you for our audience.